Abdul, always good to see you. What does this tell us? That Ebola is much harder to fully eradicate from the body than we thought?
Yeah, so it definitely complicates what we understand about Ebola and the way that it interacts with the body. It suggests to us that some of what we call these immune-privileged parts of the body may, in fact, be seeded with Ebola while somebody's infected. And because the immune system, which is responsible for killing off the virus, can't actually get into some of these compartments, it festers there and can cause the uveitis or the eye infection that we saw in Dr. Kosher, and potentially hearing loss, potentially it might stay in the testes and be ejaculated in the semen. And in that respect, it can stay in the body of somebody who's been infected even after the blood has been cleared.
Staying with Dr. Crozier's case, it seems that the Ebola was in one eyeball and, as John told us, not in tears, so he likely was not contagious?
Yeah, so as far as we know, it wasn't on the surface of the eye, nor was it in the tears, which are really what you worry about with respect to diseases of the eye, especially infectious disease of the eye, something like a pink eye, for example. And we know that patients with pink eye, when they touch their eyes and then touch something else, that's how the pink eye spreads. But with Ebola, in this case, it was very clear that it was not on the tissue or in the tears, and so there was no risk that he was spreading it. What is interesting, though, is that it was, in fact, in the humor of the eyeball, which is, you know, if you think about it to the analogy of a house, it's like the most distant room in a very, very large house that nobody goes in or comes out of, and to have seeded Ebola just suggests, in his case, that he had a very, very serious infection such that the Ebola was able to get out of the blood and get into the eye.
But semen is different, because semen, if the virus is there, then conceivably you can transmit Ebola that way.
Yeah, so evolution has made this bet that in certain tissues the likelihood of getting infection is so low that it's better that the immune system just has no access to those areas to make sure, because the immune system sometimes can act up and can cause problems on its own. And two of these places are the eye, which we saw with Dr. Kosher, and the second one is in the testes. And it's bad news that Ebola can be found in the semen. But this is something that we've known for a while.